Coronavirus. What is a coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). The most recently discovered coronavirus causes coronavirus disease COVID-19. What is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China, in December 2019. Symptoms. The most common symptoms of COVID-19 are fever, tiredness, dry cough, flu. Some patients may have aches and pains, nasal congestion, runny nose, sore throat or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Incubation period. The incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 2 to 14 days, most commonly around 5 days. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. This is why it is important to stay more than 1 meter (3 feet) away from a person who is sick. Note: studies suggest that the virus causes COVID-19 is mainly transmitted through contact with respiratory droplets rather, while the risk of catching COVID-19 from the feces of an infected person appears to be low. Prevention. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. 1. Regularly and thoroughly clean your hands with an alcohol-based sanitizer or with soap and water. 2. Maintain at least 1 meter (3 feet) distance between yourself and anyone who is coughing or sneezing. Avoid touching eyes, nose and mouth. IV. Make sure you, and the people around you, follow good respiratory hygiene. 5. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze, then dispose of the used tissue immediately. 6. Stay home if you feel unwell. If possible, avoid traveling to places, especially if you are an older person or have diabetes, heart or lung disease. 7. Be sure to comply with any local restrictions on travel, movement or large gatherings. 8. Ensure good food safety practices all time. Handle raw meat, milk or animal organs with care to avoid contamination of uncooked foods. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of elbow or tissue, and maintain a distance of at least 1 meter (3 feet) from people who are coughing or sneezing. The following measures are not effective against COVID-2019 and can be harmful: smoking, wearing multiple masks, taking antibiotics in any case. If you have fever, cough, reduce the risk of developing a more severe infection and be sure to share your recent travel history with your healthcare provider. Who is at risk of developing severe illness? Most people, about 80%, recover from the disease without needing special treatment. Older people, and those with underlying medical problems like high blood pressure, heart problems or diabetes, are more likely to develop serious illness more often than others. Who should wear a mask to protect himself? Only wear a mask if you are ill with COVID-19 symptoms, especially coughing, or looking after someone who may have COVID-19. Disposable face mask can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. Treatment. Antibiotics do not work against COVID-19 virus as they only work on bacterial infections. They should only be used as directed by a physician to treat a bacterial infection. There is no current medicine can prevent or cure the disease, while some Western, traditional or home remedies may provide comfort and alleviate symptoms of COVID-19. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials that include both Western and traditional medicines. Is there a vaccine, drug or treatment for COVID-19? Yet there is no vaccine and no specific antiviral medicine to prevent or treat COVID-2019. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19. Subscribe the channel and like the video. Thank you.